Hi guys, it's Carol. How are you? I'm doing pretty good. Here comes Toby. Can you say hi? Poor pitiful dog. Got to get a haircut. Hi. I wasn't really prepared to do this video. I intended to do it later tonight when I could do a little more research. But my grandkids are coming to spend the night unexpectedly. Their mom got sick and they're going to come spend the night with me. And I can't breathe. We had some rain today. It was wonderful. But that makes my asthma get stirred up. So if I'm huffing and puffing, I'm okay. It's just hard to breathe. Anyway, the subject of this video is about a serious topic, but there's good news. And this video isn't for children. September is National Suicide Prevention Month. There is a new number to call. That's the good news. The new number to call is 988. Before, we had a 10-digit number to dial to get to the National Suicide and Prevention Hotline. 988 is a number to call for mental and crisis problems pertaining to mental illness. 988. If you are suicidal, if you are having a mental breakdown, crises of any kind, called 988. It connects you to professional people who understand and can talk to you and help you get help. 988. I've got some notes. Let me tell you a little bit about it. Suicide and Crisis Lifeline, that's what it's called. It became available nationwide July 16th. Anywhere in the United States, you can call 988 and be connected. Before, when people were having a mental illness crisis, people would call 911. But 911 was never set up to address these kind of problems. All they can do is send the police out. And you need somebody who knows about mental illness to help you, rather than you get arrested or something. Stats prove that police activity, 20% of their total staff time involves dealing with individuals experiencing a mental health crisis. 20% of their time. Now, I am a big police supporter. I love people who serve us by being a police officer. But in 2021, more than 2 million people experiencing a mental health crisis were booked into jail. Jail is not what they need. And I'm not blaming the police. This is what they could do. I'm not blaming the police, but more than 2 million people booked in jail because they're having a mental illness crisis. Besides that, 1/4 of all fatal shootings by police, 1/4 of them involve somebody with mental illness. These people need help. The police officers need help to deal with them. The mental illness patient needs help. Well, Trump in 2020, Trump signed into law a bill to create this 988 system. The Department of Health and Human Services, Substance Abuse Mental Health Services, and the administration and the Department of the VA all participated in creating this. And the money is to train staff and develop centers. So when you call this number, you are connected to a professionally trained person. to help you. In 2021, the Suicide and Mental Health hotline, I guess, they were able to able to get to 85% of the calls. 15%, they didn't have a chance to help. They were able to handle 56% of the text. 44% of the text didn't have a chance. And on chats, at best, they were able to handle 30%. But now, because of this 988 system, Biden dedicated $432 million to fund professionals and to create these centers. It only went nationwide July 16th of this year. Already, they are able to handle 90% of their chats, up from 56%. I don't have the stats on actual phone calls or text, but that has come up that much is indicative that it's working. And if you know anybody with a mental illness, even if they're doing fine right now, make sure they know about 988. If you know anybody who's in a crisis, goodness sakes, tell them about 988. Call 988 for them if you need to. The 10-digit number for National Suicide Prevention still works, but it will route you to 988 is how it will happen. And if you've been a sub of mine very long, you know mental illness runs in my family. Has for generations now. Let me tell you about when I went to the hospital. I've suffered with depression since forever. I mean, honestly, as far back as I can remember, now I know those feelings were depression. I didn't get help until I was in my 40s. I know, a long time anyway. During those years that I didn't have help, I had a suicide plan. I had a lot of thoughts about suicide. I didn't want to die. I just had these thoughts. Well, then when I was in my 40s, I started seeing a psychiatrist, got help, therapist, blah, blah, blah. Had medication. But then when my insurance company would no longer pay for the name brand medication I needed, I had to go to generic. It did not work the same. And I went into a horrible depression spell. My depression has never gone away. It's just not nearly as bad sometimes. But it's always on the back burner, you know. Well, anyway, when I had to go to generic medicine, didn't work as well for me. That was, I guess, in the fall of this particular year. (2009) is when it was. By January, I just was a total basket case. I heard about a celebrity's child that committed suicide, and the thoughts just started bombarding me harder and harder and harder. They could do it. Why can't you? This is what you need to do. And those thoughts in my mind, I wasn't thinking about suicide. They just bombarded me. The thoughts in my mind. It was like two separate entities. There was me, and there were these thoughts in my mind that were pounding me with these thoughts that that's what I needed to do. And I was simply terrified of my own self because you can't get away from your thoughts. And I was terrified that those thoughts would make me turn into doing an action that I didn't want to do. In the middle of April, I was just at the end of my rope. I was at the end of my rope. I couldn't hang on any longer. And this one day, I told a friend that I thought I could confide to how bad it was. They knew I'd suffered with depression all along, But I told them how bad it was that day. Tears were running down my face that I couldn't control. And I told them, I just can't hang on any longer. And we talked a few minutes, and bless their heart, this person had no clue what to do. We ended the conversation by that person saying, well, hang in there. I just told them I couldn't hang on any longer, but they didn't know what to tell me. I should have called the National Suicide Prevention Line. It never entered my mind because my mind was just full of do this at. I could not think straight. It never crossed my mind to call the suicide prevention number, honestly. If I had have, more than likely the police would have come to pick me up. As it happened, when I finally got to the day when I had the breakdown and I just literally couldn't hang on any longer, I started crying over absolutely nothing. But I couldn't stop crying. I could not. It was just had overtaken me. And so I drove myself to a doctor's office. And when I went in, the office manager knew immediately what was wrong with me. Tears were just pouring down my face. And she talked to me and told me I had to get to the mental illness hospital in our town and that she would call the police to take me. I did not want her to call the police. I had driven, my car was at this doctor's office now, for one thing. I told her, no, I have to get my car home. And because I've had other family members in the mental illness hospital, I knew the kind of items you could take. You can't take just everything. I told her, please, I'll go home and pack my bag, and then I'll go to the mental illness hospital and get my car home. And she said, okay. I told her I could have somebody else take me. She said, okay, but if you are not at the hospital within 30 minutes, the police are going to come look for you. Okay, fine. That was fine with me. So I got what I knew I could take, and I went to the general hospital here emergency room. That's how you have to do it where I live. You have to go to the emergency room, be seen by several different doctors, and then eventually they will either send you home or send you to the mental illness hospital. I cried for like 10, 12 hours, honestly, just over nothing, just tears running down my face. I was in the emergency room all that time. Finally, I saw a psychiatrist, and he told me, we're going to put you in a bed here until there's one available at the mental illness hospital. There's not a bed. There wasn't a bed available right then. I had to wait till somebody was discharged. Then I went to the mental illness hospital. If you are scared of somebody putting you in the mental illness hospital, let me tell you, my experience was wonderful. Just going there was scary, but immediately there was a weight lifted off my shoulders because I knew everybody in that building, their job was to watch me and take care of me. And that was such a relief. I knew the voices could not take over and harm me in any way. The scary part is when you go in, you go through some locked doors. The door shuts behind you, you hear the clank. You go through another set of doors and another set of doors. You were locked in there. But the people there were wonderful. The only complaint I had was about the food, hospital food. I stayed 7 days. Typically, everyone stays 3 days because that is what insurance says they'll pay for. So usually patients come, they stay 1 to 3 days, and then they send you home. In most cases, you're not ready to go home. I mean, this isn't just like catching a cold and then, you're over it in a couple of days. It's not like that. Not like having a throw-up bug that you get it out of your system and then you're fine. It's not. When they sent me home after 7 days, I was, I'm going to say slightly more than a vegetable. My mind could not comprehend anything. Luckily, I had family that would take care of me. I went home. I sat in a recliner all day when I wasn't in bed. I had a little black schnauzer then. I petted Gracie, my little schnauzer. I petted her. all day long. That's what I did. I ate when my daughter came over and put a plate of food in my hands. I took a shower when my family said, you got to get in the shower. Let me help you. You got to get a bath, get some clean clothes on. Those things did not cross my mind. Not even to eat, did not cross my mind. I ate when somebody handed me a plate and said, here, eat this. I was like that. I got out in May. I was like that all summer. And finally, probably about August or September, Casey, my daughter, told me, you have to get out of this house. We have to start doing something. I could not read. Reading is what I've done every day of my life since I was about 6. I just love to read. That's been my way to escape. But when I got out of the hospital, I couldn't read. I could read the words, but I couldn't connect one sentence to the next. It made no sense to me. I couldn't comprehend it. So that was scary to me. And, but anyway, she said, you've got to do something. And so we got to get you out of this house. So I would go outside in my yard, and I had a flower bed with 4 o'clock plants. And if it was a good day, I would go out there and would hunt for the 4 o'clock seeds. Why I did that, I don't know. But that is what I did. I could go outside for 10 or 15 minutes and hunt for 4 o'clock seeds. And that was the most I could do for a long time. What brought this all up today? I knew it was National Suicide Month, and I knew I should say something about it, but I just hadn't. But today I went to my son and daughter-in-law's home, and they have a lot of 4 o'clock plants. And I saw the seeds, and I started gathering seeds. And I thought about, there was a time when this is all I could do. There was a time when I judged whether I was having a good day or not by if I could go out for 10 minutes and hunt for 4 o'clock seeds. I'm just telling you this, that if you know somebody with a mental illness problem, they need help. They need help. Even when they get out of the hospital, if they're hospitalized, they need help. And in my case, I had to have medication, and I had to have medication that worked for me. But anyway, I'm going to stick on a clip about 4 o'clock seeds. When I went to my son's house, I saw their 4 o'clocks were, the plants were about to die. The plants don't look real good, but I could see the seeds, and I started gathering seeds, and I thought about how far I have come. It's taken years, but I'm pretty good now. Here, I want to show you my 4 o'clock seeds, but remember 988. Okay, here comes the video. See the little black seeds? They look like a teeny tiny avocado to me. But when the plant is healthy and lush, you can hardly see them. You have to hunt for them. And that is what helped me get out of the horrible bad depression I was in, was hunting in these lush green bushes I had, hunting for those 4 o'clock seeds. I love 4 o'clocks now, for sure. I always did, but I do love them now. We had a little rain today. I told you I couldn't breathe. Well, we had some rain today. Thank goodness. We need it so bad. So this is what it looks like. I don't know if you can hear it or not, but anyway, I'm going to go now, guys. I'm fine. I hope you're fine. If you know anybody that needs to know this number, 988. Professionals can help you. Okay, guys, bye. Talk to you in the next video. It'll be a happier one.